Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Every year, on the 19th of June, we celebrate World Sickle Cell Day. This is the day when we commemorate the achievements in the fight against sickle cell. With me in studio are consultants from Mulago Hospital in the Department of Pediatrics who specialize in the treatment of sickle cell and children's blood diseases. To tell us more about this rather common disease that disturbs so many people, we have Dr. Kasirye Philip, who heads the Sickle Cell Clinic at Mulago, and Dr. Munuve Deogratius, a consultant in blood diseases of children. You're most welcome to the show, doctors.
Thank you. Thank you.
And I am your host for the show, Dr. Dara Sowachi. So we want to understand more about sickle cell. It's a very common disease. We hear people explain that sickle cell is the disease of children. They get yellow eyes and they get a lot of pain. But what exactly is sickle cell? Dr. Philip, maybe I'll start with you.
Thank you
What exactly
very much.
is this disease called sickle cell?
Okay, thank you very much, doctor. So, sickle cell, simply put, is a disease of the blood. But to make it clearer, we all have blood, and the blood is red in color. And what makes it red is a pigment called hemoglobin. It is actually carried in the red blood cells. So basically, this pigment is very important in carrying oxygen. Oxygen is a fuel that the body uses to function normally. So this red pigment is very important in carrying oxygen from the lungs when we breathe in to the various parts of the body to enable the body to function normally. So with this disease called sickle cell, they have changes, sudden changes that render that red pigment abnormal. Okay? And that's where the disease starts from.
So why precisely is it called a sickle cell?
Okay.
It gives the impression that it is a cell which is defective, but you're pointing towards the
Yes.
pigment.
Thank you very much. So, like earlier stated, the whole problem starts from changes that occur at the level of the pigment, that red pigment, which confers a red color of blood. But it is contained in cells which are called red blood cells. And these cells are usually, if you look at them under a microscope, they're usually round or ovoid in shape. Okay? So, why is it called sickle? When these changes do happen, the shape of the cell changes from that ovoid shape to a sickle shape. A sickle is an instrument that's used to cut grass or rice.
It is like that, almost like a half moon.
Yes, half moon actually. So basically the name was acquired from that, and from the observation that in these people who had this condition, which later on was called sickle cell, had this unique appearance of cells in their blood when looked at under a microscope.
And that's where the name comes from, the
Yes.
sickle cell.
Yes.
It's due to the red cells which appear abnormal because of a defective pigment, the hemoglobin.
Exactly. Perfect.
Okay.
Thank you.
So, Dr. Deogratius, how exactly does this disease come about? Why are the cells abnormal?
So the cells are abnormal because of lack of oxygen. As Dr. Kasiri had mentioned, the red cells carry oxygen. And when these red cells lack oxygen, they change shape and they become sickled. And that's the hallmark in which they change shape.
Okay. Yeah. But the, the underlying cause behind this whole sickle cell, is it like malaria? Is it because of one infection which has entered the cells and has changed it? What exactly results in the abnormal pigment, the abnormal hemoglobin?
So this abnormal hemoglobin is actually as a result of a genetic change or switch. So if we go to the finer details, you will look at how the cells are formed. So when there is this defect in two proteins, so there's actually a switch between the proteins, and that leads to the abnormal shape when there's lack of oxygen. So if you go deeper into the definition, it's actually a genetic disorder of the red blood cells.
It's a problem of genes affecting the red cells.
Correct.
So it isn't that someone can get sickle cell from maybe like an HIV or a malaria, which can easily be transmitted. It appears to be only limited to genes.
Correct. It is actually a genetic disorder which is transmitted or passed on by your parents. So both your mother and your father need to have that gene for you to have sickle cell.
Okay. So just how common is this disease, the sickle cell disease? Is it a very common problem you see in Uganda?
Thank you for the question. I'll go back in history. In 1945, a first study was done in Uganda to look at how common this disease was. And in the Midwestern Ruwenzori region of the country, the study was conducted. And they found a very high prevalence, meaning of every 100 people who were tested, 45 had sickle cell disease.
Oh, that's almost half the population there.
Yes, in the area. However, fast forward, we decided as a department, with guidance of the Ministry of Health, to conduct a nationwide study where we looked at up to 100,000 samples of children born in hospitals, and a prevalence of 1.5% was determined from that, and this is countrywide. If we look at it more specifically, the range can be between 0.5 to 1.5, depending on which region. And in terms of the regions, the northern and the east central regions are actually the most prevalent. And what is important to note in this distribution is the occurrence of malaria. So malaria and sickle cell, they go hand in hand. Wherever you have a lot of malaria, you have a lot of sickle cell.
But it doesn't mean malaria is the cause of the sickle cell.
No, it is not.
Okay.
Yes.
They just happen to go together. That when it's an area of high malaria, concurrently there's also a high burden of sickle cell.
Yes. So the important thing to note is that when you have the sickle cell gene, it protects you from severe forms of malaria. And that is how the gene is moved from one generation to the other. Those who have the gene are not able to get severe forms of malaria, and they don't die compared to others. So they're able to push the gene from one generation to the other.
Okay, I think we'll come back more to talking more about the genes and disease, but we want to find out, Dr. Kasiri, this sickle cell disease, who is at risk of getting it, given it's a genetic disease, it comes from genes. So who might get the sickle cell disease?
Thank you very much. So actually, like earlier mentioned, and like Dr. Deo has mentioned, it's a genetic disease. It means people are born with or without that component, which we are referring to as a gene. Okay? So basically, patients with sickle cell anemia are born with it. This gene normally hides if it is in single form. If, for example, this individual got the gene from only one parent, knowing that we actually are born as a result of component from both the mother and the father. So we actually take up some genes from the mother and others from the father. And in this case, the person at risk of sickle cell anemia means that this individual got one of the sickle cell genes from the father and the other from the mother. In other words, the person with the manifestation of the disease will have a pair of genes.
They'll have
sickle cell.
two genes of the sickle cell.
Yes, one from either parent.
Okay. So what if they get one gene?
So then they
also
become carriers
They become carriers.
And like Arya said, this gene hides if it is in single form. If you have one gene, you may not manifest the signs and symptoms of the disease. Okay. It will only manifest if
you have two genes.
If you have two genes.
Okay.
One from either parent. So a child born to parents who are carriers has a risk of having sickle cell.
To reflect, a carrier, you said, is a person who has one gene.
Yes.
So after the break, we will now come back and learn more about what happens when you have the sickle cell, genes. And if you have any questions, you can always send on our social media platforms on Facebook, Twitter. We're always happy to hear from you.
You are watching the Doctalk Show.